It's my great pleasure to be here with you. Welcome, everybody. I'm Professor Maitam Ghali Youssef, Vice President of International Society of Health Education. We will start the conference entitled Variant, a New Novel Virus, held by International Society of Health Education in collaboration with Iraq Medical Association, Al Qadisiyah University, Liverpool John Moores University, and Al Rafidain Center for Dialogue. May I ask Dr. Salman Rawaf, the chairman of society, to start the conference by welcome letter. Dr. Salman?
Please unmute yourself.
Hello, everyone. Good morning, good afternoon, good evening, anywhere you are in the world. Welcome to another meeting of our International Society of Health Education. And we look forward today to a superb collection of scientists and in the field talking about a very important topic, really about the Delta variants of the COVID-19. Of course, SARS-2 changed since the identification of the virus in Wuhan in December 2020. However, there is now, while we are in Delta, which is almost in many countries, covering about 90–95% of all reported infection. Some of these are very severe, unfortunately, and we know that with this infection, we have a very high level of transmission. So some people are asking the question, is this a new variant or is this a new virus? And hopefully today, my colleagues from around the world will give us some insight into what's going on. And also we will have a touch on the vaccine and how it's effective. Let us start together and learn today. And may I ask everyone to please mute, so allowing our distinguished guest, to contribute to our today important event. Professor Maitam.
Yes, thank you so much, Dr. Salman.
Good morning, good afternoon, good evening, good night, wherever you are. I think we're all over the world. It's still 3 p.m. here in Washington, D.C., where I live, and I'm very glad to be with the team here. I think the title of this discussion, is this a novel virus, or is this a different virus? The words are different. We're trying to play with the words just to tell the people what's going on. I will share my screen, and hopefully I can start now. Do you see my screen now?
Yeah, we can see it. Yeah,
okay. Okay. So this is my pointer, and so is Delta variant a new novel virus, Let's first come to the words I will try to use here. I'm trying to talk about what a novel virus is and whether this Delta variant is a novel virus. And I wanted to talk about transmission types, how this would affect what we will do, and the current status of the coronavirus in the world. First of all, the word novel originated from the Latin word novus, which means new. So again, is this a new virus? This is the question that we are trying to talk about. A virus, by definition, a virus or bacterial strain that was not previously identified is called a novel virus. And that's what people now are talking about, the Delta variant, as if it is a new virus coming or emerging. SARS-CoV-2 was not previously seen in humans. That's a fact, a well-known fact. But let's know that 75% of emerging infectious diseases, and this is a specific term, emerging infectious diseases, and there are also re-emerging infectious diseases, those that had disappeared and came back again, are of 75% of them are of animal origin. The spillover of pathogens from animal hosts to people is the main source of a novel pathogen. This, of course, is not actually applying to the Delta variant. Many of the components of the Delta variant we have been exposed to and we know very well, and it's part of our management and portfolio of viruses that had been either admitted to our bodies or we have been vaccinated against. So the word novel here, or a new virus, is quite questionable. We can say a new virus, but it's not novel. That's the story. This is a novel virus discovery. For example, Dr. McIntosh in 1967 discovered the OC43, which is a coronavirus infecting human beings. And that is one of the four strains that infect human beings, but still are not as dangerous as the other three strains that developed later on. Those are the four strains of viruses. This is the one that was discovered by Dr. McIntosh. And they were from the mid-60s infecting human beings with minimal impact on health, just because those are making around 20% of our common cold viruses that we get in wintertime. And that's for some time was the idea that a lot of people are not getting the severe form of the disease because they have been infected with that kind of virus previously with those viruses, and there's this cross immunity between them and the SARS-CoV-2. If we come to the three very dangerous pathogens or high impact pathogens, we have the SARS coronavirus, SARS-CoV, which emerged in 2002 in China, and it was not very much easily transmissible. That's why it disappeared, totally disappeared after a year and a half to 2 years. It affected like not much people and killed around like 800 people only. MERS-CoV actually emerged 10 years after that in 2012. It was very prevalent in Saudi Arabia, although the origin later on was tracked to be southern Jordan. And this one is more like associated with camels as the intermediary transmitters. It is, again, like any of the famous SARS coronaviruses are, the coronaviruses in general, sorry, not the SARS, coronaviruses are originated or are hosted by bats very much. And then we ended up like after 10 years, this one emerged. After 10 years, around 10 years in 2020, if we can say, SARS-CoV-2 became prevalent in the world. And this is what we are talking about today. So coronaviruses are not new. They are something that we have been dealing with for years, but the virulence and the impact of the virus became more evident after those three dangerous strains, not variant strains, emerged. So we are now in this strain, which is a novel virus itself. And in Arabic, they call it Corona al-Mustajid. That means no novel virus. And so we are very much dealing with the same virus, whether it's a Delta variant, Alpha, Beta, Epsilon, Kappa, whatever is the version. Let's look into transmission. When those outbreaks start, they start like there's no cases first, and then there are sporadic cases, and you notice that this is when the cases emerge here and there at individual level. But later on, when it become more like clusters, that will make us more afraid and thinking that this might develop into a more dangerous type of disease. Once we reach community transmission, then we are in a bad shape. We need to take all the precautions that are required to stop community transmission. We need to end community transmission. The only ways we can end community transmission is either temporarily by curfews and not letting people go outside their homes. Of course, they will not share the viruses, so they will not transmit the disease, but that's not a final solution. That's a temporary solution, because you will not be able to fully kill the virus until you have absolute lockdown on everyone in their homes for a long period of time until all viruses die. And that's not like a true scenario, a realistic scenario. So the other way is either the second way, or the more permanent way of getting rid of the virus, is to reach the community immunity, or what's called herd immunity. And that is either by getting the infection reaching everyone, but that's a dangerous and a very expensive pathway we go through, or we start a vaccination campaign which will give herd immunity or community immunity, but on the more safe side rather than the dangerous one. High community transmission is what we are trying to stop, because if there is high community transmission, there is a high viral replication rate. A new variants will come out of this replication process. Each replication of the virus might end up with a small error in the process of replication, and then we end up with more replications, more mutations, and one day we have a new viral strain. Look here, it's a strain, it's not a variant. Once we reach a new viral strain, that is going back to the starting point, and we need to do all the things we have done since the SARS-CoV-2 started. We need to do clinical studies, and we need to create test kits, and we need to do all the precautions for a new virus, which could be more deadly, less deadly, we don't know. But a new virus to come, we have to have changes in the immunogenicity of the viral protein. And that is not yet present in the Delta variant. The changes in the Delta variant are more in the spikes, but the nucleic material, the viral protein itself, the genome of the virus had not potentially changed. That's why it's more transmissible, but it's the same virus. This is the United States, and we can see types of community transmission. There is high transmission, if you can see here, the ones that are in red, and there is substantial transmission, which is orange, which is better than the high transmission. And there is moderate, the yellow one, and there's low, the blue one. And I live in this blue to moderate area, this part of the country, where Washington, D.C. is. So still, although we are living in an area with, it is still community transmission, so we need to be very careful. But at the same time, in addition to being a community transmission area, but it's like kind of low transmission, we still carry face coverings every time we go into a shopping center or a place where people are gathered together. So if we look into how much change has happened with the new variant. Each person infecting 2 people in the original strain. That is the reproduction rate. That's the RO, the value for the virus, for the original strain that emerged from Wuhan, China, and then it invaded the whole world. But if we look into what Delta is providing now, each person is infecting 8 to 9 people with the Delta variant. So it is more and more transmissible, as we talked about. It is 60%, Delta variant is 60% more transmissible in comparison to the original strain that emerged from China. So that is something very significant. And if we look into the United States numbers, this is over July, this is July 1st, and this is July 31st, and these are the 2 days from August, we can see that there is a rise and 300% rise in COVID cases. So we are accumulating cases. And I'll tell you who are being affected by those infections. The CDC actually had an internal document And in that internal document, they said Delta variant is as contagious as chickenpox. And for those who are working in epidemiology and vaccinology, they know that if you want to achieve the community level of safety, you'll have to have a certain level of vaccine coverage. You need to have 90 to 92% vaccine coverage rate to achieve herd immunity with chickenpox. So if it is as contagious as chickenpox, that means we need to go that high in immunization, immunizing the people. And you know how difficult it is with people who are very much rejecting and afraid and keep on adding those theories about the vaccine itself. So can we compare the original strain to Delta strain? Of course, there are certain areas we can strain. Viral load is 1,000 times higher with Delta variant. So you can tell why people are getting that much infection and disease. Delta transmits in 4 days versus 6 days average. Those are the average periods, incubation periods. So that's good and bad because you infect a lot of people, but the signs and symptoms will show up very early. So people can be aware of this person is sick. But it is 1,000 higher viral load. That's very dangerous. Of course, it's very difficult now to compare between the two strains. In the original strain of Wuhan that started and invaded the world, in the first few months, like 5 months, I believe, there were no treatments. There was no Actemra. There was no dexamethasone was not used. And the treatment modalities and remdesivir was like immune modulators were not available at that time. And there was no vaccination. So and when we compare now the disease and say it's very highly transmissible, but most of the people, at least in my country, in many countries in the world, have had vaccinations. So it's not easy to compare people who have been vaccinated to people who are not. And then you say, this is more transmissible and that one is bad. It could be much more transmissible, but the vaccines are making it less prominent as a transmission. So we know that vaccines in the best scenario were providing 95% of protection. That's what at least mRNA vaccines are showing. So there is a 5% chance of breakthrough cases, breakthrough infection. So it's not strange when we see someone who have been vaccinated who get the disease, because this is like was expected already when the first published papers came out of the efficacy of the vaccine. But we look into vaccinated people contracting COVID is what we call breakthrough infections or breakthrough cases. This is like very new. The CDC published the July data in the United States. We had 6,587 breakthrough cases. That's a 1 month total amount of people who have been fully vaccinated and got the disease. Out of those 6,500, 6,239 were admitted to hospitals. So they were hospitalized. And 1,263 of them died. So there are more than 1,200 people who have died from the disease, although they are fully vaccinated. So it's not something like, what is going on? Why do we vaccinate? I will tell you why we do vaccinate. Because if we look into the percentage of how many people have died from where, more than 163 million people were fully vaccinated against the COVID-19. Out of those 163 million, we have 1,263 deaths after having infection, although they were vaccinated, breakthrough infection. If we come to count those in percentages, less than 0.004% of vaccinated people experience breakthrough infections resulting in hospitalization. So that's the percentage. And less than 0.001% have died from the disease. That's by looking into how many people were fully vaccinated and how many people died out of those after being fully vaccinated. And we are expecting 5% to get the disease. This is way, way less than the 5% because we said the vaccines are effective around like 95%. Looks like the effectiveness, not the efficacy, the effectiveness when we look into the vaccines and how they are behaving in the community, looks like they are much better than we expected.
Mm-hmm.
And if we look into like those who refused, mainly the main disease is happening right now is among the unvaccinated people in the United States. And don't say like, I would refuse vaccination and rely on treatment. I can take the disease and wake up well. And if I don't die, I'm okay. Even if you don't die, you might need, for example, a lung transplant because your lungs were totally damaged by the infective process and they end up with fibrosis. And then after lung transplant, you'll end up like to become an immune compromised for life because you'll have to take immune suppressants to let the transplanted organ survive and not rejected by your body. Unvaccinated individuals are forming 97% of COVID hospitalizations and 99.2% of COVID death. Those are deaths. Those are the CDC numbers that were released 2 days ago in the United States. And it is estimated that vaccines had helped 275,000 lives, and they prevented over 1 million hospitalizations in the United States. Misinformation is one of the biggest problems we have. This is just a demonstration. Like misinformation can lead to death. So those who are spreading misinformation and are educating against the vaccine and against public health measures in general are actually causing big harm to the population and are causing unnecessary deaths from diseases that are a disease that's vaccine prevented. US reached 70% now vaccine goal. That was today, like between yesterday and today. That was President Biden's goal. If we look into the United States vaccines, at all ages, we are at least one dose, 57% and 49% fully vaccinated. But that includes those are not yet eligible to vaccine. That's for children from 0 to 12 are included in this. 12 and up, we have higher readings, but because like the vaccine is new for the 12 years old. And this is the achieved number by the president, 18 years and up. We have 70% one dose, 60% 0.6, 2 doses or fully vaccinated. And those who are above 65, we have very good rates, 89% and 80% of the people who are above 65.
Okay.
Okay.
Your sound disappeared. Carry on.
Can you hear me now?
Okay.
Yeah.
Yes. Go on. Yes. Yes.
Yeah. Because someone unmuted I think it's
okay, no problem.
I muted all and I was muted.
Okay.
Anyway, so this is the United States new reported cases. That's from the beginning of the pandemic, and those are the waves. Like this is first, this is second, this is third, or maybe this is first, this is second, this is third, this is fourth. Those are meaningless, like waves or names. And the problem is community transmission. If it is high, this is dangerous. We need to be very careful. So we have very high now rate of infection in the United States, and almost all of those, and estimate there were 90% were Delta cases or Delta variant. And if we look into the hospitalization, of course, it's compatible with the going up of cases. This is hospitalization. The interesting thing is that deaths, which of course deaths usually do not take place at the same time of the infection or hospitalization. You need 3 to 4 weeks until the deaths numbers are going up. But here it is not actually, it's been like more than like 3 weeks since we started having the climbing up of the cases. and the hospitalizations, but deaths are not compatible because we have a lot of people vaccinated, as I showed you in the country. So that means infection is happening, deaths are less, but mainly deaths are happening, as I showed you, among the non-vaccinated. To conclude my discussion, I just wanted to show you the East Mediterranean region, which Iraq is part of. The blue one is the cases, the red one is the deaths. And you can see like it's climbing up more than even the highest ever during the pandemic, because this is, those are actually epidemiological weeks. Those are not months or dates. Each year have like 52 epidemiological weeks and they count them so this is a weekly increase. And you can see like right now, the number of cases is higher than ever in the region and number of deaths is climbing up. And as I told you, they usually climb up later on. And this is where Iraq stands. Iraq has those number of cases right now, and new cases, and those are the deaths. This is my last slide. The Delta is not a novel virus yet, but sooner or later, a novel virus will be emerging, either a coronavirus or something else, because we don't know what's going to happen in the future. Viruses and us are always fighting and competing to live on this planet. Thank you very much. And
thank you, Dr. Shakir. Thank you very much indeed.
Thank you so much, Dr. Shakir, for informative talks and lecture.